Thank you. I must say that the jet lag is catching up and I'm already feeling quite sleepy, so let's see how it goes. So I'm talking about the topical skin lightening agents. The practice of using skin lightening agents has been dated back to the ancient times when Queen Cleopatra used milk in her bath. And milk, as we all know, has lactic acid that has skin lightening properties. The Chinese used ground pearl for luminous skin. Ancient Romans have used lead to whiten the faces. The Japanese used bird droppings. Bird droppings have an enzyme that exfoliates and rejuvenates the skin. And Indians have used turmeric paste, besides several others. Since we are on the topic of skin lightening, fairness as it is, I'm talking in terms of complexion, not equality. It is a sensitive subject, but I thought I should mention a few facts so that we can understand the fairness in the skin whitening industry better. Did you know that 90% of the skin lightening or the fairness industry with the skin whiteners exists in Asia? Well, apparently a lighter skin tone in these countries denotes beauty, success, and power. It has its consumers in countries like China, Japan, India, Thailand, Philippines, Vietnam, Indonesia, Malaysia, Brazil, Mexico, and there's an ever-increasing demand for a depigmenting agent that's natural and has little or no side effects. Even in Europe and in Northern America, these whitening additives are used in products and are often sold off as skin brightening or radiance products. One of India's biggest stars in Bollywood cinema, Shah Rukh Khan, as some of you may have known, endorses a product called Fair and Lovely. It's a skin whitening cream that is very, very popular and is used among all sections of the society, men and women equally. The subject of using skin lightening to lighten one's skin tone has received a lot of flack in India, and a lot of the sections of the society feel very strongly against such products and their endorsements. The supermarket aisles of these countries are filled with products ranging from face washes and moisturizers to masks, soaps, tablets, to injections and procedures, cosmetic procedures in a dermatologist's office. In general, people always want to alter their skin color, whether it is due to medical or cosmetic reasons. So in the other side of the world, we have people who want to go a few shades darker and tan, because for them that means beautiful and exotic skin. So the tanning industry flourishes too with its own evils. So coming to the pigmentary disorders, and we are talking about hyperpigmentation here. Hyperpigmentation can either be localized, that is limited to one part of the body, or it can be diffuse. The localized variety can be seen in post-inflammatory hyperpigmentation, PIH, and as the name denotes, any inflammatory process that occurs in the skin that could be because of trauma or diseases such as contact dermatitis or lupus or eczema can give rise to hyperpigmentation. Especially in the dark skin people with type 4 skin and above are very susceptible to this. Conditions such as melasma, which is the mask of pregnancy, hyperpigmentation seen on the sun-exposed areas of the face, acanthosis nigricans, which is strongly linked to diabetes and insulin resistance, seborrheic keratosis, cafe au lait macules, which is linked to neurofibromatosis disorder, and then the diffuse disease may be seen in systemic disorders or drugs and sometimes neoplasm like melanoma. The systemic disorders that cause diffuse hyperpigmentation include hemochromatosis, which is a disorder of iron storage, and that gives a slate gray or a bronzish pigmentation to the skin. Hyperthyroidism and Addison's disease is a muddy discoloration to the skin. Certain drugs like tetracycline's amiodarone can cause an inflammatory process in the skin that leads to hyperpigmentation upon exposure to sunlight, and this is called a phototoxic reaction. But there are also certain kind of drugs like gold bismuth mercury, which can cause the same kind of reaction even without the need for sunlight. Plants and food can also cause a similar sort of a reaction, and this is called a phytophotodermatitis. So when a person comes in contact or has in contact with these plants or food and is also exposed to sunlight, then they can develop the same reaction. In the consultation, it is important to elicit the onset of hyperpigmentation because certain conditions like the cafe au lait macules or neurofibromatosis have their occurrence, they are congenital, and some like the freckles have their occurrence in childhood and melasma during pregnancy. The systemic symptoms will allow us to diagnose systemic disorders like adrenal disease and hyperthyroidism, diabetes. It's important to get a detailed history of the drugs that they're on and the supplements that they have been using, and also any exposure to plants and sunlight. In the examination, it's important to note the distribution of the skin lesions that helps us distinguish between acanthosis nigricans and melasma. The size and number of the lesions become important when you are talking about neurofibromatosis or cafe au lait macules and freckles. And the border of the lesion, the pigment intensity, and the size becomes important when you are differentiating a melanoma from a benign lesion. Essentially, whilst treating hyperpigmentation, of course, it's important to rule out to identify and treat the systemic disease where there is one, and stop any offending drug or plant. Treat the underlying inflammatory process that is causing the PIH. Apart from using the topical skin lightening agents, it's important to educate the patient about sun awareness and avoiding sunlight. There are also in-house procedures that a dermatologist can do, like dermabrasion, peels, lasers. There are a number of topical skin lightening agents on the market, but not all have good quality studies behind them. It's annoying. I think that should be okay. So we'll just talk about a few of them that have some really good clinical studies. So they are classified as botanicals, and in botanicals we have botanicals such as arbutin, mulberry extract, licorice, soy derivatives. And then agents like hydroquinone, topical retinoids like tretinoin, azelaic acid, kojic acid, mequinol, and acetylglucosamine. And then there are some unregulated ones which are used in cosmetic products, at least in India, like turmeric, lemon juice, camphor, topical corticosteroids, etc. Hyperpigmentation really results from either increased melanocyte numbers, increased synthesis of them, spillage of melanin into the dermis, or exogenous pigment deposits. It's important to understand the cycle of melanin synthesis. Tyrosine, as we all know, is converted into dopa and dopaquinone by means of tyrosinase enzyme. Dopaquinone is then converted to dopachrome, which is then converted to dihydroxyindole and dihydroxyindole carboxylic acid, which is finally converted into eumelanin, which gives the skin its black-brown pigment. Dopaquinone, under the presence of cysteine or glutathione is then converted into cystinyl dopa or glutathione dopa, which gives the skin its pheomelanin pigment that is yellow-red in color. So the first step here, tyrosine being converted into dopa, that's the most important step because that's where most of skin lightening agents work, by inhibiting tyrosinase. No dopa, no melanin. Hydroquinone has been the gold standard for treating hyperpigmentation. It's been used in the treatment of PIH, melasma, and is typically used in a concentration of 2 to 4%, up to 2% in over-the-counter creams, and 4%, up to 4%, or even above in prescription strength. Hydroquinone acts by inhibiting tyrosinase, and that reduces the conversion of dopa to melanin. It's used typically in combination with retinoids, alpha-hydroxy acids, and antioxidants, and these help to increase the penetration of hydroquinone and enhance its effectivity. You must have all heard of the products like Obagi and Zeo products, and they used a combination of hydroquinone with retinoids and alpha-hydroxy acids and antioxidants. It's also used in triple combination creams, like the typical Kligman formula uses hydroquinone with tretinoin and fluocinolone. Tretinoin helps to increase its penetration, and fluocinolone helps to decrease the irritation caused by it. The results are seen in terms of a decrease in lesion size, pigmentation, and disease severity. But there has been a huge concern about the use of hydroquinone, though. Oral hydroquinone has been shown to be a carcinogen, but based on rodent studies. There are also side effects like ochronosis, which is a gradual bluish-black pigmentation that can occur mostly in the dark-skinned people, but also in Caucasian skin. And prolonged use of a high-strength hydroquinone has caused irritant reactions. FDA in 1982 had proposed a rule called GRACE, which means hydroquinone is generally regarded as safe and efficient. But in 2006, since the light of these studies, it has withdrawn the rule and has proposed a ban of all OTC hydroquinone products. It still needs to make a final rule on this judgment. Mequinol is a derivative of hydroquinone, which is used similarly in 2 to 4% and used in combination with tretinoin. It also inhibits tyrosinase, but is much less irritative. It has a much more favorable benefit-risk ratio when compared to hydroquinone. Retinoids are vitamin A compounds like tretinoin, adapalene, isotretinoin, tazarotene. These, as we all know, improve photoaging, and they're used in the treatment of PIH and melasma. Tretinoin is used in the concentration 0.01 to 0.1%. Vitamin A compounds have a property of promoting wound healing. Apart from that, they also have an anti-inflammatory action, and they can reduce the post-operative milia that you can see after lasers or peels. So hence, they are preferred by a lot of physicians, both pre-treatment and post-treatment. They also help in neocollagenesis. Irritant dermatitis has been a risk with why it's happening, but yeah. They are limited by their by the side effects that they can cause, like redness, erythema, peeling, and post-inflammatory hyperpigmentation. So really the trick with retinoids is to use a smaller dose, reduce the dose, and gently titrate it upwards. They also do well when used in a cream-based formulation or when diluted with a moisturizer. Azelaic acid is a dicarboxylic acid which is isolated from Pityrosporum ovale. It's used in a concentration of 15 to 20%, and that's just as effective as using hydroquinone. When used in the same concentration, 15 to 20%, and used along with glycolic acid, it can be as effective as 4% hydroquinone. It's very effective at decreasing the pigmentary intensity, and the side effects are very, very mild. This is really my choice of skin lightening agent that I use this to maintain my clients. Kojic acid is a tyrosinase inhibitor. It's a chelation agent that is produced by Aspergillus oryzae. It's used either alone or in combination with glycolic acid or hydroquinone. It is typically used in 1% concentration in cosmetic creams and up to 1 to 4% in the skin lightening preparations. Kojic acid does have some side effects, though it can cause irritant dermatitis and also has a very high sensitizing potential. In fact, I've had 2 of my clients who had this sensitizing potential. I don't use it anymore in my practice, and it's also been banned in Japan over mutagenicity concerns. Arbutin is a glycosylated hydroquinone that is derived from the leaves of bearberry, pear, and cranberry. This also inhibits the tyrosinase activity and inhibits melanosome maturation. Its efficiency increases with higher concentrations, but again, it produces also paradoxical hyperpigmentation when used in higher doses. Niacinamide is a derivative of niacin, vitamin B3. It has been used in the treatment of acne, but studies now show that it is a good skin lightening agent. It decreases melanosome transfer and melanogenesis. It is used in a concentration of 2 to 5%. It's used either alone or in combination with N-acetylglucosamine. This is also a very favorite skin lightening agent used in the Indian cosmeceutical industry. In fact, I know some of the dermatologists like prescribing it to our Miss India contestants weeks before the pageant. N-acetylglucosamine is an amino sugar which is a precursor to hyaluronic acid, and it inhibits tyrosine glycosylation. It is used in 2% concentration either alone or in combination with niacinamide, and it's quite well tolerated. Ascorbic acid, as we all know, is a vitamin C compound, and it's naturally occurring antioxidant that is present in fruits and vegetables. It suppresses melanin synthesis purely by means of its antioxidant action. It is used in 5 to 10% concentration or even higher, and in combination with other agents like HQ. Studies have shown that it is not by itself as efficacious, but when used in combination with hydroquinone, it is effective in treating photoaging and melasma. I use it because vitamin C has an anti-inflammatory action, so it reduces the post-laser and post-peel procedure erythema that you see and helps in neocollagenesis. So I like to use this with my clients. Licorice extract is a plant extract, and it has some active agents like glabridin, licocalcone, which inhibit the tyrosinase activity, and licoritin causes depigmentation by causing melanin dispersion. It is used in cosmetic products like Image MD, and this is also favorite cosmeceutical seen in the Indian cosmeceutical market. Soya has some protein protease inhibitors like soybean trypsin inhibitor and Baumann-Berg protease inhibitor. There's a very complex mechanism of inhibition of the PAR2, which leads to depigmentation, and it's also commonly seen in skin moisturizers for skin lightening. Chemical peels, as we know, help reduce the dyschromias. They're used to treat the dyschromias and the post-inflammatory hyperpigmentation. They're often used alone or in combination with the skin lightening agents. There's several different types of chemical peels. The superficial chemical peels they're very effective in all types of skin, even in the dark-skinned individuals. They cause minimal scaling, erythema, and are highly effective. We have the glycolic, which is used in a concentration of 20 to 70%, salicylic acid, lactic acid, and many more. We have the moderate depth chemical peels like the TCA, which is used in a concentration of 15 to 35%. It can be more irritative in certain skins, the dark-skinned individuals. So a lot of physicians like to pre-treat the skin to suppress the melanin pigment and reduce the irritation and reduce the incidence of PIH. I like to pre-treat with a few alpha hydroxy acids, like few glycolic peels, before I put them on the TCA. And there's not been any problems with that. There are also deep peels like phenol, which are no longer used because of the cardiac abnormalities that they can cause, and they are not suitable in dark-skinned individuals. There are also combination peels like modified Jessner's and yellow peel. it is important to select a peel that causes less irritation, because the incidence of PIH increases if there is irritation. And this is the reason why a lot of physicians try and pre-treat with agents like tretinoin, hydroquinone, and alpha-hydroxy acids. Melanin has a very wide absorption spectrum, ranging from 250 nanometers to 1200 nanometers. Now, any lasers that use a wavelength that is lesser than this will target the endogenous epidermal pigment in the skin, causing burning. And hence the longer wavelength lasers like the 1064 nm Q-switched Nd:YAG laser has a great margin of safety and is very effective, and is effective also in people with and safer in dark-skinned individuals. The fractional ablative and non-ablative lasers have been used quite extensively to improve the photoaging anyways, but what's interesting is the post-procedure cosmeceutical use with them, because there's already the thinner stratum corneum because of the result of the because of the action of the lasers. The cosmeceuticals tend to penetrate more, and in theory is supposed to be more effective. And then the IPL that is used in pigmented lesions. Of course, the lasers are limited by the PIH that they can cause, and hence again, we like to pre-treat with the skin lightening agents to reduce the incidence of PIH. Hyperpigmentation is very prevalent, and it happens in skin of all types to varying degrees, and hence there is an importance to, it's important to arrive at a safer alternative, which may be a natural, and that's where we're going, that's safe as well as effective. So there are a number of emerging therapies as well, but it remains to be seen it remains to be studied the exact role of these agents, the safety, and the effectiveness. So thank you.
Thank you very much, Dr.